Menteri Rangbah Kejala Meghalaya Konrad Kongkal Sangma ulong baka kynhun menteri kala ajing Mynjur ka Meghalaya Pharmacist Service Rules bad ka Meghalaya Mental Health Care Rules. Bad ka kynhun menteri kala pediang ya ka Meghalaya Mental Health Care Rules ka ban penuan dore kurukom trekam bad ikarukom kemi bad penyat ika jaka ajing sumar ya kibaran kejing keta ha kabor perkat perdan ha kejela. Ulong bagi ni kendon kilong kebakong sanba damar begidon bon ki jaka ajing sumar kiba kemi ika kot kakya ki jaka syong jaka sa bat kiwe kijing dan kam da kebenta kokot kakya ajung gitu kibaran kejing keta ha kabor perkat. Ulong baka jela kam syamladon ni ki rules ban pentrekam ne kamat trekam kom ta menta ki Mynjur ya kini ki rules.
We did not have service rules for the Meghalaya Pharmacist. So those service rules were approved today by the cabinet. Also, there was the adoption of the Meghalaya Mental Health Care Rules. Again, these are very important. So we have different institutions that are dealing with healthcare, rehabilitation, and other mental health care activities. And as a state, we did not have rules to operate or to govern, or no policies were in place. So today we have passed those rules and we're calling it the Meghalaya Mental Health Care Rules.